Namaste. I'm Dr. Gillian Holsworth and I'm a trustee of the BritainNepal Medical Trust. I worked as a doctor in Nepal for 2.5 years, many years ago.
I am Shobana Gurung Pradhan, Director of the BritainNepal Medical Trust. I work together with a team of 45 staff members who are working in 38 districts throughout Nepal.
We want to tell you about why the Trust makes a difference to the health and well-being of Nepalese people.
The BritainNepal Medical Trust, or BNMT as it is widely known in Nepal, has two health improving themes, one clinical and the other cultural.
The clinical theme is the control of tuberculosis. TB is still a major problem in Nepal. The BritainNepal Medical Trust supports the Nepalese National Tuberculosis Programme with a simple approach to TB diagnosis, which doesn't rely on doctors and x-rays for diagnosis, but on training laboratory technicians and microscopists to look at sputum. When we examine sputum, we can find TB bacteria, and when people are found to be positive for TB, we refer them into the Tuberculosis Control Programme for treatment. This approach achieves 85% cure rate.
An untreated TB chest patient can infect 10 to 15 other people, so finding infected patients is vital. BNMT trains female community health volunteers to identify symptomatic patients and guide them for free treatment services. To raise awareness of both tuberculosis and now HIV/AIDS infections, BNMT trains actors to perform simple drama in villages to encourage prevention and treatment.
More recently, the Trust has been working in collaboration with WHO on active case finding. This approach is developed in order to maximise the number of patients who are infected with TB and get them into treatment, and thus reduce transmission within the community. The second area of the Trust's work is working with disadvantaged and conflict-affected groups of people in rural villages. Women, children and lower caste people are often poor, exploited and unhealthy. Through enabling people to participate in group activities, BNMT and local NGOs advance the use of advocacy and innovation to improve health and well-being.
Villagers appreciate the improvement in health for work and family life. They appreciate the fundamentals of safe water and sanitation for health. They understand that mothers and babies need not suffer and die, but can expect skilled help. They understand how health services can provide care. They are encouraged to sit on health and district committees and advocate for better provision and quality. Better health leads to improved education for children and employment for adults.
And finally, the Trust supports the Ministry of Health and Population in their policy development around human resources for health. In Nepal, there are major constraints around recruitment and retention of staff distribution, and their continued professional development. BNMT works with the Ministry in trying to address some of these difficult issues.
The BritainNepal Medical Trust has had support from a number of organizations and foundations that has contributed to our work.
Nepal is a good neighbour of Britain. It has the history of the Gurkhas in our armed forces and the romance of mountains conquered by Lord Hunt and Sir Chris Bonington. But Nepal is still a very poor and unhealthy country. The BritainNepal Medical Trust really does make a difference, so please support our work. Thank you.
Thank you.
Namaste.